Lots of patients come to my consultations and ask me, how do I know if I need a breast lift? And this is a really common question. The way to answer this question is to know, where should the nipple be? Ideally, the nipple should be roughly halfway up the breast, so half the breast tissue is below the nipple and half above. A simple way to decide or to know where the nipple is to look where it lies in relation to the inframammary crease. That's the crease where the breast joins onto the chest wall. If the nipple is at or below the crease, then the patient needs an uplift. If the nipple is above the crease, no uplift is needed. So if you look at these pictures, you can see that the blue line points to where the nipple is and the red line points to where the crease is. And in the first picture, you can see that the blue line is above the crease. So this patient does not need a lift. Whereas in the second picture, you can now see that the blue line, showing the position of the nipple, is below the red line, which shows the position of the crease. So that means that the nipple is below the crease, and thus this patient would benefit from a breast lift. Most people thinking about a breast lift are a little bit wary of the scars, and they are right to want to know more about this, because in order to perform a successful breast lift, additional scars around the breast are needed. There are three main types of breast lift scars. The first is a scar just round the nipple, and this is called a periareolar or a donut lift. The second scar is round the nipple and down, and that's called a vertical or a lollipop lift. And this is the most common type of breast lift in my practice. The third type of breast lift involves a scar that goes round the nipple, down, and underneath the crease of the breast, like an anchor-shaped scar. So it's called either a Weiss pattern or an anchor-shaped scar. When talking about a breast uplift, one of the most common questions I get asked is, do I need implants? And the answer to this depends on two things. Firstly, how much breast volume a patient has, and secondly, what look they're after. If there is minimal breast volume, which may have been lost as a result of either weight loss or breastfeeding, then an implant is usually required. Secondly, if more upper bowl fullness is required, a breast implant may also be needed. It's easy to explain this point by looking at these pictures. In the first picture, the patient has undergone a breast uplift but no implants, and you can see that the slope in the upper part of the breast is more natural. In the second picture, the patient has also undergone a breast lift, but in this case she also has had implants placed, and you can see that the upper bowl, the top half of the breast, is fuller, and that's as a result of the implants. When you meet your surgeon, he'll be able to explain whether an implant would help or not. A breast uplift can be done as a day case procedure. Usually it's done under general anesthetic, but it can be done under sedation and, in selected cases, also under local anesthetic. The procedure takes 1.5 to 2 hours. All the stitches are dissolvable, and the patient goes home the same day with a compression bra. It's advisable to avoid any heavy lifting for a couple of weeks, though it's important that the patient is walking around from day one. The dressings come off 2 weeks later, and patients can resume their full range of activity thereafter, building up to allow full recovery by 4 to 6 weeks. The pain associated with the breast lift is actually not as great as one might think, as primarily the surgery involves operating on skin and tissue rather than on the deeper structures or muscles.